Hello everyone, this is Mrinmay Mishram Karlunde from Sampark e-Polyclinic, and the topic for my today's video is oral sensory and motor issues seen in feeding. It is found that the feeding disorders occurs in 25 to 35% of normally developmental children and 40% to 70% of children with developmental disabilities or chronic medical conditions. Looking at this, it is obvious that the feeding disorders are more common than we think. Here are some questions that we get asked frequently from the clients coming to our clinic. Why does my child take a long time to have food? Why does he or she doesn't prefer all types of food? Why are they just swallowing everything in their mouth without chewing? Why are the meal times becoming so difficult? The idea behind this video is to help all the parents understand and relate to the oral sensory and oral motor challenges that the children might face. This in turn would help you all get a better idea about the child's need and would help them with the healthy growth and development. Feeding a child is not only critical for survival, it is also an integral part of a social experience. A child who can't eat or won't eat can have a serious impact on the entire family's quality of life. Feeding issues typically fall into one of the two categories or a combination of two, that is oral motor issues or oral sensory issues. So let's look what are the oral motor difficulties. The oral aspect of eating involves how the mouth muscles functions, how strong the muscles are, how well they coordinate the range of motion, and how far they can move as they manipulate food in the mouth. Although eating is very simple, automatic for most of us, it's actually very complex. The jaw moves in a rotatory motion to chew and adequately break down the food. At the same time, the tongue manipulates food from side to side, up and down to assist in breaking down the food, ultimately forming the food particles into a bolus in preparation for the swallow. It's complicated. It requires tongue lateralization, tongue elevation, jaw strength, rhythmic chewing, and coordination. So let's see what are the oral sensory difficulties. The oral sensory is mainly related to the tissues in the mouth, that is, perceiving sensory information such as taste, temperature, and texture of food. Sensory food aversions can be present in one of the two waves or again sometimes in a combination. Hypo-sensitivities, meaning little to the absence of oral awareness, in where we could see behaviors such as mouth stuffing, also known as food pocketing, or children loving to eat food throughout the day, or having children leftover food particles in their mouth or drooling. All these behaviors noticed are mainly because the child cannot fill enough in their mouth. So, if the child cannot feel food or food particles in the mouth, he or she won't know to retrieve and swallow them. The next is hypersensitivities, meaning too much of oral awareness. In this case, the child may gag or vomit, spit the food, or turn away from the food or resist by crying, kicking, screaming, present with a range of behavioral issues. So, what are the symptoms of oral motor and oral sensory issues? Symptoms of motor problem includes slow and efficient chewing, food falling from the child's mouth, gagging, coughing or choking, low intake of food, or pocketing of food. The symptoms of motor sensory problems include food aversions, crying during meal times, vomiting, gagging, or drooling. So many parents have these questions that how do sensory motor systems come together during feeding? The sensory and motor system functions as a feedback loop. Sensory input impacts motor skills and movement impacts sensory perception. If a child has difficulty in differentiating taste, texture or temperature or location of food in the mouth, it may be difficult to handle food safely. Holding food in the mouth for longer period of times or swallowing foods that are not chewed or adequately masticated or eating non-food items, etc., may result in gagging, choking, and vomiting. Food refusal and self-limited diet may often result of compromised oral sensory motor skills and negative experiences which results in behavioral responses. For example, a typically Developing toddler may react surprised, interested, or highly dismayed when introduced to a new food taste. In fact, a toddler with feeding issues may become hysterical, or he or she may turn red and start gagging. So, if you see such kinds of problems in your child, you should immediately consult a speech language pathologist. When a child with feeding problem is referred to a speech language pathologist for a self-limited diet, a comprehensive feeding assessment is required, including a review of the child's medical status, fine motor skills, gross motor skills, develop oral motor development, nutritional status, and sensory processing as well. Since the sensory and motor systems cannot be separated, it is very important to task analyze the child's motor skills and determine how they relate to feeding before assuming that a self-limited diet is purely behavioral. In order to understand a child's diet profile, it is important to collect the necessary data and analyze the data in conjunction with information collected on the child's oral sensory motor skill development. To meticulously understand a child's taste, temperature, and texture preferences, a diet report of 5 days would be helpful. So, filling out a form reporting all foods consumed over 5 days, including the brands of the food, including the amount consumed by the child, and also the utensils that were used. This will help the therapist establish a home base, which is a profile of taste, texture, and temperature in the child's diet. Diet shaping starts with the child's existing profile and slowly expands the child's taste and texture. The therapist must look at the underlying oral sensory skills to support safe, effective, and nutritive feeding. So let's see what are the feeding issues. How do we manage it? So alternating a child's position significantly improves oral motor and swallowing function, which helps optimal the positioning during feeding, can support the child's breathing, which allows the child to focus energy and attention on feeding rather than maintaining postural stability. It helps in optimizes the child's oral motor coordination, making chewing and swallowing more easier. Often, when we work with a child with feeding issues, it is tempting to look at the jaw, tongue, and the lips and forget about the posture. Thus, we need to decide on the sitting arrangement that can give and provide adequate pelvic stability, which will support trunk control. This will in turn influence the head control, jaw stability, and motor control. So, looking at the sitting posture while deciding on the positioning, the following goals and arrangements needs to be kept in the mind. So, the feet should be flat on the surface while eating. The knees should be bent comfortably over the edge of the seat. The hips should be rested all the way over the back of the seat. Midline position maintained in the sit. Neck and head should be positioned upright and the elbows should be at the table's height. After taking care of the right positioning, a speech language pathologist can lead him or her through exercises that strengthen the mouth muscles and build a proper feeding techniques. On the other hand, if a child is facing a sensory problem, the speech language pathologist will recommend desensitization therapy, which includes repeated exposure to problematic foods or textures, or may suggest modifying the child's mode of feeding. For example, changing the type of the bottle, cup, or straw until the child's feeding abilities gets improved. Or playing with food is also a very fantastic way of exposing children to food without the demand of eating. As they are exposed to food through play, they get used to the sight, smell, and feel of the food on their hands. This would also help in the desensitization process, thus allowing more acceptance of food gradually into their mouth. Hyposensitive children may need extra sensory information such as flavoring of the food to recognize the presence of food. If there's a behavioral component to your child's feeding issues, the psychologist helps in identifying the right kind of reinforcement, carefully deciding on the food choices and textures which can go a long way with treating feeding issues. So let's move on to the exercises that we recommend to our children. So the first exercises we recommend is blowing bubbles. This is for lip and Cheek weakness. It is fun, but kids will play with bubbles and without even knowing that it's a therapy. You can also use straw to drink. This works on every aspect of the child's mouth. Children should be using straw and cups by 1 year of age. You can also make funny faces. Have your child look in a mirror and imitate funny faces. Again, these faces will be depend on what weakness a child is displaying. Also, practicing chewing exercises for toddlers will also help. You can also use the lollipop. Yes, they can be used in therapy. Your therapist will have your child lick the lollipop or different candies using their tongues in different positions so that the tongue gains strength. Doing tongue exercises for speech therapy is very important. So you can move your tongue and touch to the upper lip. You can touch your tongue to the lower lip. You can touch your tongue in the left direction. You can touch your tongue to the right direction. You can also puff your cheeks, and you can also move your lips in all the three directions like A, E, U. By following all this exercise, this will help your child overcome all the oral and sensory motor problems. If you have any questions regarding this video, you can write us down in the comment section, or you can also follow on our website, that is www.samparkeclinic.com. Thank you for watching this video.